So this is the first of two screencasts to help prepare you for the session that we're going to have together. The first screencast is going to cover setting an agreed agenda with your service user. The second screencast will explain about how we talk about medical conditions in everyday language and how we exchange information with our service users using a skill called EPPE. And in the session, we will look at how your communication skills link with you following through the model and process of nutrition and dietetic practice. So what I'm aiming to achieve in the session is to introduce to you and to help you facilitate the skills to set an agreed agenda in your consultations. We'll be working on how to explain medical conditions and how to exchange information. So at the end of it, you should be able to use good communication skills to set an agreed agenda. You should be able to explain at least two medical conditions in everyday language. You'll be able to use EPPE to facilitate information exchange, and you'll be able to link your skills with using the model and process of nutrition and dietetic practice. So let's first focus on setting an agreed agenda. And this is actually within the BDA curriculum framework. That's something that a graduate dietitian, should be able to do. And it's necessary, whether it's an inpatient or an outpatient, whether it's an initial consultation or a follow-up consultation, or when you find yourself in a position where your service user has a different agenda from your own. Usually, you set an agreed agenda at the beginning, after you have developed some rapport with your service user and you've introduced yourself. And so all the things that we looked at last semester. It may need to happen later on if it becomes apparent that your agenda and the service user's agenda are quite different, and that can happen. What we're looking at is something that's often described as a working alliance. So you're coming to an agreement as to this is how we are going to work together. This is what we're going to focus on. So what are we trying to achieve? We're trying to make sure that the purpose of the consultation is agreed between yourself and your service user. And if you do that, you are working in a person-centered way, which, if you remember back to last semester, was something that we looked at quite a lot. We are meant to be working in a person-centered way, and setting an agreed agenda is part of doing that. And you've got to bear in mind that you are expecting your service user to consent to a consultation, but if they don't understand what is likely to happen, then how can they do that? So that you've got to check that they have the same understanding as you. It also helps you to establish appropriate boundaries, so the time frame that you understand that you've communicated about confidentiality, that what's going to be covered. And sometimes you'll have to clarify what a dietitian can and cannot do, because there are occasions where a service user may have an different understanding of what is within your role. So initially, what we're talking about is something involving our service user, or sometimes it's called engaging. So part of this you've already looked at: meeting and greeting service user, introducing yourself and your role. So it's about that bit of small talk, you're building rapport. And then going on to check the reason for your service user having made the appointment. Can you explain to me what led to you making the appointment today? And that also helps resolve the difference that you might find between a reason of referral given to you by another healthcare professional and what the service user thinks was the reason for that referral. So it's a way of screening or checking that you've got the same understanding of why you're both there at that point. It's also a good opportunity for you to explain what usually happens in the format of a consultation. So, what should the service user be expecting? To clarify what your role is and to explain, what are you going to do with these notes that you're taking? How are they going to be maintained in a confidential way? So it's our responsibility to ensure that the service user is making an informed choice and realistic goals within that. So if you're going to set this agenda, then the service user or patient can consent to that. But if you haven't gone through that, they can't have informed consent because we haven't provided the information. So one of the things we have to be aware of is that patients or service users don't always want to make changes. And that's okay. They're allowed to be in that position, even though that's not what we might necessarily want for them. So one of the things we can ask is, what would you like to focus on today? And sometimes they're not going to know. So sometimes you'll get a very vague response from that. I don't really know. I don't know because they don't know enough about the condition or the dietary aspects of that condition. So we might have to take a step back before getting our agreed agenda. So it might be that we have to say, well, would it help if I explained the medical condition and what the dietary recommendations are? Because sometimes the service user will have very little knowledge of their condition and the dietary recommendations. Other times they will have Googled it, read quite a lot, have quite a lot of understanding, and therefore be able to say, this is what I want you to help me with. But sometimes they're not going to know. So we've got to get that clarity. So it might be that, we will explain the dietary recommendations for type 2 diabetes, for example, and then has that service user got any thoughts on what recommendations they'd like to focus on? Are there any changes that they're interested in exploring? It's really important that we get that agreement, because if they've said, well, actually, this is what I'm interested in, that's much more likely to lead to behavior change. So it could be that they have very long-term goals, like, well, actually, I want to maintain my blood sugar within the healthy range. So that might be the big goal, but we might therefore have to work on some smaller goals to help them to get to that point. So whatever we do in that session, if that's their long-term goal, needs to be working towards that. So we're trying to find common ground. We're trying to find something that we know is going to be helpful in the management of their condition and that they feel they're happy to begin to work on. So it's finding that common ground. We do that, we're much more likely to have adherence to treatment plan. So there are challenges with this. It might well be that we have different agendas. So we have an idea of what we want to achieve in that consultation, and the patient service user has a completely different agenda. Sometimes they're just not clear on the agenda. Sometimes people are going to need quite a lot of help to get to that point. So we have to offer suggestions and see where they want to go with that. But clearly with children, perhaps with some people with learning disabilities, although my experience tells me that a lot of people with learning disabilities know exactly what they want to focus on. But sometimes people, who are unwell or distressed, and if you think back, you think about the things you may have seen on your first placement, people will have different understanding and different levels of help that they're going to need. So it's a bit of a dance, a bit of a journey, discovering what's going to be most relevant to them. The other thing to remember is if you have a service user with a carer, that carer may have quite a different agenda to the patient. So, we've really got to be mindful of those kind of situations. When you have a follow-up consultation, so you're seeing someone for a second or third time, one of the things you really need to do before you see them is to have a quick look at the notes and review what was agreed the previous time. But never make the assumption that their agenda is still the same. So you need to explore, has there been any changes in the agenda since you last saw them? Or is it still the same? So we're going to have to make sure that we do the same process to say, well, this is what we were talking about last time. But I'm just wondering, do you still want to continue with that, or has anything changed? So you're exploring that to make sure that you stay person-centered. So in the second screencast, we will cover the information exchange.